My name is Maarten Houben and I will present our paper, Design Opportunities for Care Transitions in Dementia, Understanding Informal Caregivers Experiences through a Practice-Informed Approach. This work was a collaboration between TU Eindhoven, Fontes and Archipel Care Organization. People in the early stages of dementia commonly live at home independently, supported by informal caregivers in activities of daily living, such as cooking, personal hygiene, or household chores. And as dementia progresses, the care needs of people with dementia increase and become more demanding for informal caregivers. When overburdened informal caregivers experience emotional stress and fatigue, the person with dementia will typically transition from home to formal residential care. This transition occurs when the person with dementia has reached a stage where they require more constant supervision. There are significant safety concerns at home, such as wandering or falls, and the family caregiver is no longer able to provide the level of care required due to physical, emotional, or logistical challenges. The decision to transition to formal care often falls upon the informal caregiver, burdened by the physical and emotional stress of caregiving, which often results in feeling guilty of institutionalizing their loved one. The transition from aging at home to formal residential care is widely reported as hectic and stressful for people with dementia and their informal caregivers. In the field of HCI, there have been numerous studies on how interactive technologies and online services can support the well-being of people with dementia and their caregivers in providing assistance in daily activities, supporting communication, seeking online information or support, or offering leisure activities. These studies address important challenges in the context of dementia set in both home and residential care environments. However, there is limited work on how technology and accompanying services can support the care transition process regarding moving from the home to a formal residential care setting. Therefore, more insights are needed into how technology could support these experiences and challenges across various stages of dementia and care. In this paper, we address the following research questions. What are the experiences and challenges of informal caregivers of people with dementia before, during, and after a transition from home to residential dementia care? And how can technology support these transitions in dementia? We adopted a practice-informed research approach in close collaboration with care professionals who were involved as co-researchers. The care professionals actively formulated the initial research aim regarding care transitions, proposed interview protocols based on their professional experiences, and conducted the interviews. We aimed to elicit more in-depth responses from the participants related to interactions with the healthcare system, as the questions were based on the practical expertise of the care professionals. The care professionals were innovation managers, part of a regional consortium in the Netherlands, consisting of 3 care organizations, Archipel, Vitalis, and Doctor. Care organizations nationally reported that informal caregivers were, as a precaution, enrolling their dementia-afflicted relatives onto waiting lists for formal residential care admissions increasingly early. Placing people earlier on a waiting list causes problems when others have more urgent need for placement. Therefore, the problems concerning the misuse of waiting lists were prioritized by the care professionals in the regional consortium as a starting point for the interview study. Based on the intermediate results and initial coding, the focus on waiting list was expanded towards different moments of the transition from after the diagnosis to care at home and eventually admission to formal residential care. After each set, the interview questions were adapted based on the initial coding of the transcripts to focus on emerging themes. The first set of interviews targeted informal caregivers whose relatives with dementia were recently subscribed to a waiting list for care home admission out of precaution. The initial coding from the team of care professionals was focused on the changing role from relative to caregiver and how the care load increases over time to the point that the informal caregiver cannot sustain the care demand. Set 2 addressed informal caregivers' perceptions of how the relationship changed, how this impacted their personal lives, and which support the informal caregivers received from a wider social network, such as family and friends. The initial coding revealed the lack of communication, being pushed to the limit, and how dementia develops to such an extent that caregivers can no longer cope with their role and their loved ones are admitted to formal care. Set 3 targeted informal caregivers after the transition of their relatives with dementia to a formal care setting to reflect on the lack of support, problems, and struggles that eventually led to the care home admission. The initial coding resulted in a lack of knowledge, experienced emotional burden, missing information, and false expectations of informal caregivers regarding the care system, which was often only realized too late. Set 4 addressed caregivers of relatives with dementia who recently received a diagnosis. Participants were asked about their information needs and the availability and accessibility of current information sources. The care organizations recruited 42 informal caregivers in total, of which 14 were spousal caregivers, 26 adult child caregivers, and 2 adult children-in-law. Set 1 waiting list, Set 3 admission, and Set 4 diagnosis each involved 10 participants, and Set 2 home consisted of 12 participants. The care professionals who conducted the interviews provided an initial coding of the interview transcripts. Next, the HCI researchers in this project took the lead in conducting an inductive thematic analysis on the data corpus of all interviews. Finally, the teams were presented to the care professionals, after which their comments and remarks were included in the final teams. Permission required voluntary inclusion and informed consent from informal caregivers as participants in the study. The participants expressed a need for information regarding the care system, coping strategies, progression of dementia, and caregiver experiences of peers. For example, as illustrated in this quote, participants wanted a more realistic picture early on of what to expect from the progression of dementia and how to recognize the different stages. Participants indicated they received information from multiple sources and were often overwhelmed with information from all fronts. Participants especially preferred receiving information from people as a source of information, as illustrated by this quote. However, participants mentioned that extensive training programs for informal caregivers were often too time-consuming. Many participants used online resources early on to get additional information about dementia. However, participants reported challenges in finding information online, such as being overwhelmed by all the information sources. As illustrated by the quote, participants mentioned they felt at risk of missing essential information due to this abundance of availability. As the quote illustrates, participants in all sets described how the workload of informal care grew increasingly heavy over time, as the ability of the person with dementia reduced over time. Participants reported emotional struggles when witnessing that memory, recognition, and ability slowly diminish in gradual steps. With this increasing care load, participants experienced a changing role in their relationship with the person with dementia. Adult child caregivers describe difficulties in their changing role, not looking forward to visits anymore since the main purpose has become caregiving. Confronted by the progression of dementia, participants described their worries about not knowing what to expect next. Overall, participants expressed that deciding on the right moment to transition a person with dementia from home to formal residential care was challenging. Many informal caregivers underestimated their current situation, a perspective for which a participant warned as in this quote. Participants struggled with the tension between missing their loved one with dementia and reaching their breaking point regarding moving forward with a placement. Misalignment and disagreement can complicate the decision-making process, such as differing views between the person with dementia and their informal caregiver, leading to conflicts. In another case, one participant described how she prevented the hospital from moving her mother to formal residential care. Such a comment from a respected medical institute can instill insecurity and uncertainty in informal caregivers. And finally, participants reflected on how they were more at ease after the care transition and in hindsight positive about the transition to formal residential care. Care home admission brought them peace of mind, but also enhanced their family relationship with the person with dementia. Therefore, when there is a good fit with the care home, people looking back at the process recommend transitioning to formal residential care earlier. Based on our findings, we identify design opportunities for technology to support care transitions in dementia. Our findings indicate that adaptation should also be a characteristic of supportive technology for informal caregivers with continuously changing needs. We identify design opportunities for technology to support decision-making and dynamics in the dementia journey through dynamic care coordination platforms, decision support systems for alignment, and soft landing in residential care. For example, our findings highlight how the incremental progression of dementia causes informal caregivers to doubt and remain uncertain regarding admission to formal residential care. We identify an opportunity for support systems to assist informal caregivers and healthcare providers in making informed decisions, increase transparency about the transition process, provide recommendations based on the individual's health status, and offer available care options considering the preferences of the person with dementia. Our findings illustrate how informal caregivers also need more information and clarity about the dementia condition and its progression, the care services available in the region, and the administrative tasks involved. Technologies can be employed to support tailored and accessible information through situational information to manage expectations, personalized information sources, and support from experienced peers. Based on our findings, we suggest novel opportunities to connect informal caregivers new to the role with peers who have more experience in the dementia care process. More experienced peers can provide emotional support and share relevant information on best practices in care transitions. For example, social media platforms or online spaces can be cultivated to facilitate such exchanges. Our practice-informed research approach rooted the methodology in real-life scenarios and challenges present in current care practice. As dementia is a continuum that covers many different phases, perspectives, and stakeholders over time, we see an important role for HCI in targeting and embracing these complexities. By adopting practice-based approaches, future HCI research can support reshaping policies, improving care systems, and elevating care standards and quality of life for people with dementia. We thank all participants and care professionals for their involvement in this study. Feel free to reach out to us if you have any questions.